Welcome to today's Explainer. We're jumping right in today, essentially putting on our hard hats and adopting an architectural blueprint mindset. We are going to map out the exact foundation, framework, and finishings you need to build a highly effective oncology care coordination platform for the year 2026. Because let's face it, software isn't just a supporting tool in healthcare anymore. It's literally the primary infrastructure through which care is delivered, monitored, and continuously improved.
Okay, let's start by looking at this massive number, $280 billion. Coordination chaos in healthcare isn't just a minor administrative headache, it's a staggering $280 billion problem. And in the high-stakes world of oncology, things like fragmented scheduling, missed dependencies, and siloed data, they don't just drain provider finances, they have a direct, real-world impact on patient survival. When diagnostic results are delayed or treatment planning is disjointed, care absolutely suffers. This financial and clinical reality is exactly why modern platforms have to solve for fundamental operational gaps rather than just adding more digital noise.
You know, the unfortunate truth is that most apps designed to fix this coordination chaos just end up as shelfware. Actually, scratch that. They become expensive digital paperweights. They're frustrating, isolated applications that clinicians just naturally abandon. True coordination software, on the other hand, is smart. It's deeply embedded into the daily workflows of the care teams, and it actively empowers nurse champions. If a platform doesn't focus sharply on dynamic care pathways, tumor board collaboration, and seamless interoperability, there is no way it gets adopted. And without adoption, well, your return on investment completely evaporates. So to avoid building shelfware, we need a clear blueprint. Today's agenda covers 1. The coordination chaos problem. 2. Data standards and interoperability. 3. AI and patient-centric design. 4. Bulletproof cybersecurity for 2026. And 5. Operational integration and ROI. Let's get right to it. Section 1. The coordination chaos problem. To solve operational gaps, we really have to stop chasing shiny objects and fix the underlying dysfunction first. Moving to Section 2. Data standards and interoperability. Enabling interoperability is our foundation here. Because in 2026, data continuity is absolutely non-negotiable for coordinated decision-making. At the absolute heart of this data foundation is something called M-Code, which stands for Minimal Common Oncology Data Elements. This is a brilliant initiative that provides a core set of structured data elements specifically designed for oncology electronic health records. By using standard patterns and controlled terminologies, M-Code ensures that research-quality data from the treatment of all cancer patients can be seamlessly shared. Without this foundational standard, sharing complex treatment data across different health systems or even contributing to comparative effectiveness analysis is practically impossible. And you see these standards come to life in the real world through initiatives like the CMS Enhancing Oncology Model, or the OEM. It's really a very clear step-by-step process. First, clinical data elements are collected directly via the electronic health record. Next, they're reported using an HL7 FHIR API, which is what allows different healthcare applications to securely talk to each other. Finally, the data gets mapped to US CDI plus cancer standards. This robust exchange ensures that whether a patient is at a massive, huge hospital system or just a local specialty clinic, their clinical data flows seamlessly. All right, Section 3, AI and patient-centric design. Let's explore how we empower care teams and build out the core framework of our platform. I want you to just think about this question for a second. We live in an era where AI can write complex code and summarize entire books in seconds. So why are highly trained oncology nurses still wasting precious hours manually copying lab results into spreadsheets? It's wild, right? The cognitive burden on clinical teams is immense right now, and a modern 2026 platform absolutely must automate these repetitive tasks. It's the only way to prevent burnout and let nurses focus on what they do best, which is patient care. The real solution to this crushing administrative burden is the integration of LLM copilots for clinical speed. In 2026, the best coordination platforms are going to come embedded with AI that operates completely invisibly, but is absolutely essential. These copilots can automatically flag missing pathology or imaging reports before a patient even walks into the room. They summarize complex intake forms perfectly for multidisciplinary tumor boards, and they can even draft templated care plans derived right from the structured data. This just drastically reduces cognitive load and massively accelerates clinical workflows. But hey, AI isn't just for the clinicians, right? We have to connect directly with the patient. To do this, platforms utilize EPROs, or electronic patient-reported outcomes. These are web-based systems allowing patients to report their symptoms in real time, right from the comfort of their own homes.
This continuous stream of data enables care teams to remotely monitor progress, catch adverse events early, and adjust treatment plans completely on the fly. Capturing the patient's voice outside the clinic walls is a massive, massive leap forward for continuous cancer care. Now, when we're designing these patient-facing tools, empathy has to be front and center. Platforms need to utilize design frameworks like mindful vibe streaming, which emphasizes empathy-driven design. The entire goal here is to create an emotionally aware user experience that reduces the cognitive load on a patient who is already undergoing heavy, exhausting treatment. We want to ensure high compliance and continuous engagement, but without ever overwhelming the person on the other side of the screen.
Section 4, Bulletproof Cybersecurity for 2026. Defending patient data is essentially the shield of our blueprint, which is absolutely crucial since ransomware is now targeting roughly 96% of medical practices.
With much stricter HIPAA compliance demands today, and AI-powered social engineering threatening staff literally every day, traditional defenses are completely obsolete. A 2026 platform requires advanced managed IT capabilities. We're talking about implementing a zero-trust architecture with identity-first security. It requires AI-driven behavioral analysis for advanced threat detection, strict network segmentation to isolate those critical clinical devices, round-the-clock 24/7 security monitoring, and automated offline backups. Listen, the cost of preparing these defenses is always less than the catastrophic cost of recovery. Finally, Section 5, Operational Integration and ROI. It's time to put the roof on our blueprint and see how this technology transforms a network into an operational powerhouse. When you have a truly integrated clinical workflow, you get this beautiful, seamless progression. You go from diagnosis, involving imaging and biopsies, straight into treatment planning with a multidisciplinary tumor board, and finally, right into therapy delivery. And the whole shebang is underpinned by a unified electronic health record. When scheduling is tightly integrated and data flows freely like this, you eliminate the bottlenecks that cause dangerous delays in treatment initiation, and you just massively improve capacity utilization across the board. But how do you actually prove that it works? Network leaders have to take concrete steps to justify the cost of the platform. By utilizing a technique called process mining, organizations can quantify exact, measurable improvements pre- and post-implementation. You literally measure the time saved per clinical task, the reduction in treatment delays, and the drop in redundant documentation. By tracking these metrics, you can correlate clinician adoption of the software directly with hard, undeniable financial and operational ROI. And all of this builds up to the ultimate goal of future state oncology network. This is a fully mature, adaptive system. It's not just about tracking patients anymore. It's about deeply integrating clinical intelligence with operational capacity modeling and predictive financial forecasting. By utilizing things like digital twins and intelligent analytics, oncology networks can anticipate variability, recover incredibly fast from disruptions, and deliver highly personalized care at an unprecedented, equitable scale. As we wrap up today's explainer, I want to leave you with a provocative thought to chew on. If your coordination app isn't architected from the ground up to effortlessly grow with AI, embrace totally seamless interoperability, and withstand the cyber threats of 2026, you have to ask yourself, are you really building a scalable coordination product that will change patient outcomes? Or are you just building tomorrow's technical debt? Keep that front of mind as you plan for the future of healthcare.